So you're about to begin your lab work around the skeleton. So let's take a look at a couple of the key features just to introduce you to the work that you're going to be doing. First, we talk about the axial versus the appendicular skeleton. So you know there's 206 bones in a human body in general. The axial skeleton is the green bones that you're seeing in this picture. That includes the 8 bones of the cranium, the 14 bones of the face, the bones of the vertebral column, the ribs, and the sternum. The axial skeleton's job is to be an axis for rotation. You can also see that it protects some critical organs, the brain and the special senses in the cranium, the heart and the lungs within the thoracic cavity. And it also serves as an attachment point for the bones of the limbs. That would be the shoulders and the arms, and then the hips and the legs. The beige bones that you see in this picture are the appendicular skeleton. They're appendages. Those appendages are the arms and the legs that attach to the axial skeleton. So you do need to learn all 206 bones, but if you take a quick look at this picture, and that sounds pretty daunting, but if we look at the ribs are named 1 through 12 and left and right. So if you can count 1 through 12 and you know left from right, that's 24 bones right there. The bones in the left arm are the same as the ones in the right arm. The bones in the left leg and foot are the same as the bones in the right leg and foot. So 206 sounds really daunting, but if you kind of break it down into smaller chunks, it's not quite that bad. So the cranial bones, which you can see here, include the frontal bone, the 2 parietal bones, the 2 temporal bones, the occipital bone, the ethmoid bone, which is a little bit harder to see because it's actually inside of the skull. And then you'll see there's some sutures as well. The coronal suture, which separates the frontal bone from the parietal bones, is also called the frontal suture. And these sutures are all joints. They're places where the bones have grown together and there's just a little bit of dense irregular connective tissue that connects them. The squamosal suture is this one here that separates the temporal bones from the parietal bones on each side, so left and right. And it's called squamosal because this part of the temporal bone is flat, and the term for that is squamous-like. The sagittal suture, which runs right here along the midline of the skull, separates the left and right parietal bones. And the lambdoid suture, which looks a bit like a lambda, like the letter lambda, separates the parietal and occipital bones from each other. So both parietal bones are separated from the occipital bone by the lambdoid suture. The facial bones, and there are 14 of these, make up the face. So one of the bones that you can't see in this picture is called the hyoid bone, and the hyoid bone kind of hides back here behind the mandible. So if you were to put your 2 fingers just inside of the mandible and talk a little bit or move your tongue, you'll be able to feel that bone moving around. It's the only bone in a human body that doesn't articulate with other bones. And you can actually see a couple of views of it here and over here. It's the one that's often broken in cases of strangulation. Okay, so let's go back to these facial bones. We have one mandible. It's actually connected in the center here by something called a mental symphysis. The maxilla, 2 bones that should fuse in the center, If they don't, that can often be classified as a cleft palate or a cleft lip. The inferior nasal concha, those help us and they give us more surface area. So when you're breathing, you have more surface area for warming, humidifying, and moisturizing air. Zygomatic bones are your cheekbones. The palatine bone is back in here. Vomer is the bottom part of this nasal septum. Nasal bones make up the bridge of your nose, and the lacrimal bones are actually pretty easy to spot. So you can't see it in this picture, but there is a little hole or a foramen in those lacrimal bones. Lacrimone means tears, and that's where the tears from your eyes can actually move into your nose. So sometimes if you have like a really good cry and your nose just won't stop running, but it's really like water, that's usually tears. Continuing with the axial skeleton, we'll talk about the vertebral column. So the vertebral column has 4 or 5 regions, depending on how they're classified, but the ones that are always the same are the cervical region, the thoracic region, the lumbar region, and then some people call these separately sacral region, coxal region, or the sacrocoxal region. In the cervical spine, there are 7 cervical vertebrae, and they're named C1, C2, C3, C4, C5, C6, C7, or you can call them cervical 1, cervical 2, etc. I'm just going to move this out of the way so you can see C1. C1 is also called atlas, A-T-L-A-S. C2 is also called axis, and axis has the dens on it, which is a point of rotation for atlas. So most of the movement that you do at your head is between the occipital bone, C1 and C2. So you do need to know C1 and C2 independently, meaning away from the spine or away from an articulated spine. The rest of the vertebrae, you would be expected to be able to identify cervical vertebrae in general, thoracic vertebrae in general, lumbar vertebrae in general, and the sacrum and coccyx. If the spine is articulated, which means it is put together as you see it here, you should be able to name any one of the cervical, thoracic, and lumbar vertebrae as C1 to C7, T1 to T12. You can see there are 12 thoracic vertebrae, which are anchor points for the 12 pairs of ribs, and L1 to L5. So you can, generally do that in the simplest way is if there was a marking here, then you could either count up from the sacrum, 5, 4, 3, 2, 1, or if there was, say, a marking here that asked, what is this vertebra, then you could count from the C1 to C7, and then 1, 2, 3. The curves in the spinal column are there to help us with weight distribution. So in the cervical curve, this is a lordosis or a lordotic curve. The lumbar spine also has a lordotic curve, which means that it curves slightly to the anterior. So anterior would be over here. And the thoracic curve is kyphotic, right? And as that exaggerates, you can see that in people, especially older women who have osteoporosis, that kyphotic curve starts to become kind of a hunchback or humpback. And then the sacral curve is also a kyphotic curve as well. The sacrum is composed of 5 fused vertebrae, but you don't have to number those. And then coccyx is composed of 3 to 5 fused vertebrae. But again, you don't have to know the numbers for those, just for the cervical, thoracic, and lumbar vertebra. This is a very typical cervical vertebra. It has what's called a bifid spinous process. So you got 1, 2 pieces there. That's the bi. And it also includes these transverse foramen. And what comes through those is an artery called the vertebral artery that gives you collateral circulation, or a secondary circulation, to the brain to make sure it never runs out, hopefully, of blood supply. So what you're seeing in the top here is a very typical thoracic vertebra. The one you see at the bottom, T12, is really a transition from the typical thoracic vertebrae to the sturdier, bulkier looking lumbar vertebrae, but we're just going to look at the typical T6 vertebra. So you can see it's got a pretty sturdy body. It's got facets or surfaces for the ribs to articulate or join against those vertebrae. And then if you look at the spinous process, you can see it kind of angles downward in the back or inferiorly. And part of that is to help prevent hyperextension of the thoracic spine so that you don't allow the heart and the lungs to be exposed, and so that you don't tear the vertebra, so that you can keep breathing. Some people say, if you look down here, some people say they kind of look like a giraffe, which might be a helpful way to remember them. This is a typical lumbar vertebra. So what you'll notice here is the spinous process is much bulkier than what you saw in the cervical spine and the thoracic spine. The body, which is this part, and over here, is also much thicker because the lumbar spine is a point of rotation. It's also a part of the spine that takes a great deal of weight bearing. So we'll finish out the axial skeleton by talking about the thorax, or the thoracic cage. So as I mentioned earlier, there's 12 pairs of ribs. The first 7 are considered true ribs, and that's because this blue stuff here, which is the costal cartilage, that's hyaline cartilage, that costal cartilage directly connects those ribs to the sternum. Ribs 8 through 12 are considered false ribs, and that's because they are falsely attached, if at all, to the sternum. So if you look at 10, 9, and 8 right here, these 3, they are connected to the sternum, but their cartilages connect to this one costal cartilage that then sort of fuses with the cartilage of rib 7. The last 2, 11 and 12, are also considered floating. So if you look at them, you can see that they aren't connected to the sternum, so they sort of float a little bit. Their main job is really to protect the kidneys, which start right around here. But that's pretty much all the bony protection that your kidneys have. The sternum is this bone in the middle. Some people call it the breastbone. Proper name is sternum. So on the sternum, we have the manubrium that has a jugular notch, which is where the jugular veins, internal and external, come up. There's also a clavicular notch where the clavicle will attach, but the clavicle is part of the appendicular skeleton, which is why you don't see it here. And the body, which is this part. And then here at the bottom is the xiphoid process. And the xiphoid process is probably most famous because that is the part where you don't want to do CPR. You don't want to do chest compressions because it can crack off. It's pretty tenuously attached. It can crack off and end up puncturing the pericardial cavity behind it.